name is Simon Bailey. I'm a consultant general colorectal and laparoscopic, that's keyhole surgeon. A hernia is a very common condition, and it essentially is a weakness within the muscle wall, usually of the abdominal wall, the tummy muscles, through which some of the internal components of the abdominal cavity can protrude, giving a lump. Well, there are lots of different types of hernias, and there are essentially the common and the more uncommon ones. Commonest hernias that we find are groin hernias such as inguinal or femoral hernias, and hernias around the umbilicus, the belly button, particularly above or below or within the belly button itself. There are then the less common hernias which generally occur higher up the midline of the abdominal wall, ventral or epigastric hernias, and very uncommon hernias such as Spigelian hernias, which occur out on the margins of the abdominal wall. Finally, there are incisional hernias which generally occur at the site of previous surgery within the abdominal wall. Well, the commonest symptom is developing a lump that the patient can either see or feel. This can be associated with discomfiture of different degrees of magnitude, ranging from mild discomfiture to quite severe and acute pain. Very infrequently, the lump becomes so tender that it can't be pushed back in again, and this can be associated with worrying symptoms such as sickness, vomiting, or change in the bowel habit. And if that were to occur, then urgent medical assistance and intervention is required. But to reassure, that is very uncommon. Well, the first and most important thing is to talk to and examine the patient. Most commonly, patients present with a lump with or without pain or discomfiture that they've noticed develop over a period of time before presentation. On examination, one can feel the lump and the weakness in the muscle wall, and also potentially feel a cough impulse where the patient increases the abdominal pressure and the content of the hernia pops through and can be felt by the examining doctor. If there is a concern, imaging is possible, usually in the form of an ultrasound scan, but it is also possible to perform CT or MR imaging if the diagnosis is more in doubt. After appropriate discussion of all the options, there are a lot of different treatments available for hernias, depending really on their site and size. Open versus laparoscopic surgery, i.e. keyhole surgery, is keenly debated and really depends upon the patient preference, the surgeon's preference, and the type of hernia. So open surgery involves a small incision made over the lump, reconstitution of the anatomy, and it may need to be reinforced with the placement of a piece of mesh. With keyhole surgery, generally the surgeon finds an area underneath the hernia, brings it all back down again, and then places a mesh plug inside the hernial hole in order to reinforce it and prevent it from coming back. Recovery is very individual, but generally speaking, people need to take it reasonably easily for 2 weeks afterwards, and I advise everybody to stay at home for those 2 weeks, although it is possible to work from home on a computer. The first couple of days require regular pain relief to keep as comfortable as possible, and gentle mobilisation really as the patient feels able to. It is sensible to avoid heavy lifting for at least a month after the surgery to give it the best chance of healing properly and bedding in. Household tasks can generally be performed within about a week to 10 days of having had it done, but one should avoid lifting anything over 10 to 15 kilos until the 6-week mark. As far as driving is concerned, most people are able to drive a car at about 10 days, but really that depends on how comfortable they feel and whether they're able to change gear, press the brakes sufficiently, and obviously it depends on their insurer. Generally speaking though, most people after hernia surgery are back to normal activities and normal life within a month of having had it done. There are lots of ways in which you can come to KIMS Hospital for a discussion about your hernia. There is the choose and book system via the NHS, referral from your general practitioner. It is also possible to pay for consultations and treatments in a self-pay package, and the hospital is able to give you information about that. And finally, of course, there are the insured patients who have insurance via one of the registered companies within the UK, and using that is also very easy and straightforward.